Let's have a conversation. Tell me what you think about the issues of the world. What kind of spice you wanna be? Tell me where you wanna travel. Do you believe in luxury? What's your hidden passion? What makes you so unique? Conversations with Nicole. Conversations with Nicole. Conversations with Nicole. Conversations with Nicole.
Welcome to Conversations with Nicole. Today's discussion is on fibroid tumors. Dr. Andrea Friall, a specialist in obstetrics and gynecology at North Florida Women's Care, talks to us about what fibroids are, symptoms, treatment, and support for women dealing with this condition. Let's listen in on the conversation. Dr. Friall, hi.
Hello, Nicole.
Welcome.
Thank you for having me.
So today we're talking about fibroid tumors, which affects many women across the country, across the world. Tell us, what are fibroids?
Well, actually, fibroids are commonly also called uterine leiomyoma, and they're benign, typically tumors of the uterus that come in various sizes and shapes. And yes, they affect women of all races and cultures, and so it's important that we discuss them.
So I'm going to stop you right there because as an African American woman, I have a lot of female friends that are African American, and they believe that fibroids only happen with African American women. So can you talk to us about that?
Absolutely. As someone that treats women of all nationalities, it certainly is more common in African American or Black women. Yet I have seen them in all nationalities, whether I've seen it in 18, 22-year-olds as well as older women. So although it does seem like a disproportionate amount that affects Black women, that is true. We typically have more aggressive and bigger fibroids, yet it does cross all lines.
Okay, so white women,
Asian women,
Hispanic women.
absolutely.
Okay, so just want to make sure we're clear on that.
It is. So yes, you can tell your friends and your viewers that it's more than just Black women.
Okay, and what do they typically look like?
Well, they're actually smooth muscle type tumors of the uterus, and a good example would be like a softball, or sometimes a good example. And when you cut them open, they actually look like a swirled appearance on the inside. So some of the symptoms that you receive or feel when you have fibroids, some women have none. They can have fibroids as big as a basketball and feel like they have none.
Wow.
Whereas others can have some that are as big as my fist and feel like the weight of the world is on them. They typically, again, are solid. They have their own blood supply going to them. The uterus itself is a muscle, and within that muscle wall, you can get these tumors, and they're individual. Some grow as, again, as big as a basketball, some a grapefruit, a plum, a grape, a pebble, and they are typically solid in nature. Sometimes they can do something called degenerate, and that's where some women get some pain from those. There is less than 3% of the time there are cancerous changes to fibroids, and those are called sarcomas. They're more rare, but certainly can be found in the uterus. So it's just important to characterize them, and once you identify if you have them, figuring out whether you should do nothing about them or whether you should treat them. And then when you decide whether you need treatment or not, you're figuring out what treatment is best for you.
So let's talk about treatment for a moment.
Sure.
What are some of the treatments?
So again, the first treatment is if you didn't even know you had them and we find them on an incidental exam and they're not bothering you, the best treatment is to monitor them. So sometimes your healthcare provider or physician may say, let's just get an ultrasound every year or every couple of years to follow them, because a clinical exam can also help with that. Now, if you do have heavy bleeding, pressure, pain, some women will complain of frequency and or feeling that they have to go to the bathroom all the time.
So these are some of the symptoms.
Those are some of the symptoms where they'll feel like they have pressure on their rectum, and typically on an exam that will be identified because you can feel the bulk of the uterus. Now, if you have to kind of divide it up into what your symptoms are, whether you have completed childbearing or have interest in having children.
Okay.
So let's start for women that still want to have children. If you have fibroids and they don't seem to be interfering with the lining of the uterus and they're not bothering anything, if you don't demonstrate signs of infertility, then you can leave your fibroids alone.
Okay.
If you're having trouble with pregnancy or becoming pregnant or even with pregnancy loss, there are times where removal of the fibroids, which is also called a myomectomy, might be suggested.
Okay.
So those are my women that want to keep their uterus.
This segment is brought to you by Brown & Brown Attorneys at Law. Stay tuned for more conversations.
Which is also called a myomectomy, might be suggested.
Okay.
So those are my women that want to keep their uterus.
Now, tell me what a myomectomy is.
So myomectomy is removal of the uterine fibroid, and we preserve the uterus.
Okay.
That surgery has evolved. We used to do it openly, meaning we put an incision on your abdomen to open it. Sometimes that still is a necessary process, especially with fertility.
Okay.
But more commonly now, we do what's called a robotic myomectomy. And that is when you can remove the fibroid using a robotic system like a Da Vinci and sew back up the uterus and keep it intact.
Oh, wow.
And so those are some exciting changes that have happened over time. But yes, in the beginning of my training, when we didn't have the robot, we did everybody with an open technique. Now, sometimes that benefit is that you can feel and make sure that you've gotten everything out of the way. With the robotic technique, sometimes you lose that tactile sensation.
The human touch, yes.
Yep.
Got it.
So then the next option, of course, is for women that have control of bleeding. So some women will feel like they don't really have any pain or anything, but their menstrual cycles are very heavy.
So a lot of hemorrhaging.
A lot of hemorrhaging. Passing clots is not normal. So you should
right.
not. And we typically blow it off because we're women, we're busy, we have things to do. So you typically just try and go about your day, and then by the time you realize that you're anemic and you're so tired all the time, and you realize how much menstrual blood you're actually losing.
So let's stop right there.
Sure.
You mentioned being anemic. Where would being anemic show up maybe in an annual physical exam?
So a complete blood count, which can be done, but sometimes even just a clinical exam, I look at patients and their hands are pale, the tongue's pale, eyes are pale, and they complain of fatigue and feeling tired. So another way to confirm that is by doing a complete blood count. And so that's what you would want to order to verify anemia.
Okay, so that's a good thing to know.
Absolutely. So getting a complete blood count, like at your wellness exam, sometimes you may go to your for your wellness exam and they just prick your finger, which is okay. That's a starting point, because if it's that low, then you may need a complete blood count. But if it's normal, then that may not be the issue.
Okay. Good.
But you can still have heavy bleeding that's bothersome and have a normal blood count. And so for those women, sometimes medical management by using hormonal options like a progesterone or a birth control pill, or even an intrauterine device sometimes with progesterone in it can be helpful. Otherwise, if the fibroids are inside the lining of the uterus, sometimes you can use something called a hysteroscopy, which I find that patients can understand better when I say hysteroscopy, when I say it's like a colonoscopy of your uterus.
Oh, okay.
So it's a camera, we put some water inside the uterus and you can see inside. And that way you don't get as scared about the word hysteroscopy, because it sounds like that. Hysterectomy.
That other H word.
The other H word.
Okay.
But a hysteroscopy leaves everything intact, except for if that fibroid's in the lining, we scoop it out.
Okay.
And that is typically a wonderful procedure for patients that are having trouble with fertility. And again, there's another procedure called a uterine fibroid embolization. So that is for patients that are no longer planning on having children. Typically, because the pellets that are used, they go in through your groin and they try to identify the fibroids and they cut off the blood supply to the fibroid. But we try not to typically get pregnant after that, because there is some compromise to the blood flow of the uterus. So that's why we use that in patients that have not.
Okay.
Now, you can get some shrinkage, because a lot of times patients are asking me, well, can't you just shrink them, Dr. Friall? There's no real good shrink laser yet.
Okay.
People have tried laser techniques. And even using the uterine fibroid embolization, you get some shrinkage of the fibroid. But if your fibroid's like the size of a grapefruit, it's not going to go down to a grape. But if you had a smaller fibroid, it'll shrink some. But so you just be careful when people talk about, oh, I got mine shrunk. it doesn't shrink them that much, but it can control some of the bleeding.
Okay, so let's talk about the H word,
Okay.
hysterectomy. Tell us what that is.
Hysterectomy is removal of the uterus and cervix. It does not mean that it removes the ovaries and tubes, which a lot of times women will feel like, I don't want a hysterectomy because I don't want to go through menopause or have hot flashes, and that's not the same thing. So even if someone has a hysterectomy, they can keep their ovaries intact, and that means that their hormones are still intact until they were not going to be. They'll still go through menopause.
All right. Stay tuned for more conversations. This segment is brought to you by Brown & Brown Attorneys at Law. Stay tuned for more conversations. Welcome back to Conversations with Nicole. If you're just joining us, today we have with us Dr. Andrea Friall with the North Florida Women's Care, and we're talking about fibroid tumors and good uterine care. We also, before the break, talked about hysterectomy, so the H word.
Nicole, you know everybody's afraid of the H word.
I know they are.
And it is, and it certainly is not a decision to take lightly. And so any major surgery, although there have been many technological advances with hysterectomy, you can still have damage to organs that are adjacent, and your life can be affected. So the most important thing is to make a good, sound decision for what your life is, what's going on with your fibroids, your life, your gynecological health, and how will your life be improved. Or if you do nothing, are you comfortable living with the decision to do nothing?
Right.
So when it comes to hysterectomy, whether we do an open procedure, which is called like a laparotomy, where they make typically a bikini cut, which most people talk about. Sometimes the fibroids are so large we have to go up and down. There are other times we can still do a minimally invasive hysterectomy with small trocar incisions or small holes on the abdomen, but regardless of how you do it, you still have to play into the mindset that you have to heal. And so before we even get to the point of hysterectomy, you want to make sure that you have exhausted all other options that are comfortable for you.
Yes.
And if you can get to menopause and their fibroids aren't bothering you, then that is great for you. However, if your quality of life is suffering because you're chronically anemic, which affects other organs in your body, and again, we talked about anemia before the break, you know, your heart needs blood and your kidneys need blood, and so if you're bleeding it all out during your period, you will start to slowly wear on the other organs of your body. So you do not want to be chronically anemic and need a blood transfusion, which is sometimes how I meet people in the emergency room for the first time who didn't realize that they had that significant of anemia. So again, hysterectomy is certainly a choice and an option, and it's a good option for women that are suffering with fibroids, significant pain, large size, things that affect their daily quality of life, because you only get one life. And so you should certainly make decisions that make that life worth living every day.
So I got to ask you about some of the schools of thought as it relates to hysterectomy.
Sure.
Some women think that they're not going to have feeling down there anymore with their lady parts when it comes to sexual activity. Is that true?
You know, there are certainly nerves that innervate the pelvic floor, so I try and have a good discussion about sexuality and nerve endings in the vaginal area. Typically, the upper third of the vagina upper part of the vagina stays intact. What most women consider their G-spot or those nerves typically are fine after hysterectomy. People that enjoy intercourse and have a good understanding of their body should still have fine intercourse after. Sometimes you do form scar tissue, and sometimes it takes a little bit for everything to kind of get back where it was. But knowing about your body and understanding that you're not going to hurt anything helps. And so it's a good time to re-explore, I think.
Okay, good. Now, the other thing that sometimes women believe is that they're less of a woman now that their uterus is gone. What do you have to say about that?
I certainly don't believe that. I understand the concept of feeling as if you're more of a woman when you have the ability to reproduce because of that womb. However, you know, I feel uncomfortable saying that you're less of a woman, because I think that some of the most brave women on this earth are my ovarian cancer survivors, my uterine cancer survivors, my breast cancer survivors that may have lost their breasts or lost their ovaries and uterus, and they're still fantastic women.
Excellent. Thank you for bringing out that point. So one of the things that I also wanted to talk about is things that we might be able to do from a preventive standpoint. I think there's some research out there that talks about being overweight.
So sure, obesity certainly plays a part in most of our healthcare issues, and that we are plagued with it on a daily basis. However, it is true that the more adipose or fat tissue that we have in our cells, we do convert that to estrogen peripherally. And so there is some school of thought that, you know, reducing the obesity, which reduces your excess estrogen, can be helpful for more than just fibroids or female-related issues. So eating healthy and trying to avoid foods that have excess preservatives and hormonal influence can certainly be helpful, but it's not proven that that is 100% accurate. So I would just say that certainly living a healthy diet, you would benefit from that.
What about genetics? How much does genetics play in fibroids?
We're not really sure about genetics. It seems that they're so common as far as, and I hope not to misspeak, but in my knowledge, I'm not going to say that they necessarily run in families. However, there is sometimes a predisposition for some family members to follow suit with their other family members.
Gotcha. Okay, very good. So there have been some natural remedies or proposed remedies that are out there. I don't know if you're familiar with some of these vaginal pearls that supposedly you can insert, and you know, this is supposed to cleanse and clean
and help with absorption.
Exactly, that sort of thing.
You know, I would just say that, you know, being cautious, that as long as it's not harmful, I would not say that you couldn't try some of the more natural remedies that are out there. You do want to avoid things that may cause infection. However, there are certainly natural oils that women have used in other cultures, and including here. Sometimes they're a little harder to get. You want to make sure that you have a pure product and that that it's clean and reputable. I wouldn't expect miracle cures, but certainly things that you may benefit from some of the may benefit from some of the natural remedies if that's what you're more comfortable with.
Okay, gotcha. So what are some of the more interesting issues around hysterectomies? Maybe from a mental standpoint, people getting mentally prepared, or, you know, maybe you are performing the surgery and you find out that, you know, it's a little bit worse than you anticipated, or maybe it's better than you anticipated. Have you experienced any of that throughout the years?
Once you get in there, you know, it's a lot sometimes different than what you expect from an ultrasound, or which preoperatively or before the procedure, we try and get as much investigation as we can. Sometimes we find that you have other conditions like endometriosis or ovarian cysts that we have to carefully weigh. What do we do? Do we just leave it there? You try and treat everything and keep in mind the patient's desires. So when it comes to hysterectomy, though, I think as long as you have a good understanding, I try not to take anyone to the operating room until I know that they realize that their uterus is going to be gone, that they have significant pain or significant bleeding. Otherwise, it's not a cosmetic procedure. It's not because my mother had one, so I know I need one. I'm not the doctor for you for that. And that typically is a kind of a Southern thing. Like, you know, they feel like after they've had their babies and then it's time to have a hysterectomy, I need a little more than that.
Really?
Oh yeah.
I've not heard of that one before.
Oh yeah, it's very common.
Okay.
So you know, I'd like people to hold on to their parts as long as possible. So but hysterectomy has its place.
It does, yeah, for sure. Well, are there any support groups for, you know, this type
There
of
are some things
procedure?
around Tallahassee,
Okay.
and Hystermoms, or there are some other places on the internet that certainly are supportive. I think that those places are safe, definitely, to just, sometimes people will just want to listen to the information. I don't know if I would put my own business out on any of those websites, but certainly useful to listen. And I just think that having a good, healthy relationship with your physician as well as your surgeon is healthy, so that you can talk about before and after hysterectomy. And hopefully, if you get to that point, that you realize that you're going to take some time to heal and adjust to your body. And so even though the postoperative period may be between 2 and 6 weeks, give yourself a good 3 to 6 months to sort of feel like, okay, everything's back in order. Because their natural response is to also feel like you should guard everything. And so you really have to get back to exercising and move to a new phase of your life, which, whether you have a hysterectomy or not, we should always do that. But
Absolutely, yeah. I can see that, because the area may be tender, because it is major surgery.
yeah, it's different. You got some stitches that need to dissolve, and so all of those things, and you have to get over all the changes. Your body's pH changes from the vagina, so that is important. But I think, again, starting from the very beginning is really, number one, establishing a relationship with your physician about your gynecological care, realizing that you can get exams every year and then all of a sudden this may pop up. It doesn't necessarily mean that they're just growing slowly in your body all the time. And then facing with your provider what the next steps for you are based on what your fertility desires are and your health status and your pain threshold and what's kind of happening with those fibroids.
Excellent. Well, thank you for your time today.
You're welcome.
All right. Thank you for joining us on Conversations with Nicole. Thank you for tuning in to Conversations with Nicole, where we connect the community through conversations. For more information on this or previous shows, visit Conversations with Nicole on Facebook, Instagram, and YouTube. I am Nicole Everett, and we'll see you next time.
Conversations with Nicole. Come and have a little talk with me. Conversations with Nicole. Come on and speak to me. Conversations with Nicole. Talk about the issues of the world. Conversations with Nicole. Have a conversation with Nicole. Conversations with Nicole. Conversations with Nicole. Conversations with Nicole.
Conversations with Nicole, where we're connecting the community through conversations. Thursday at 11:30 a.m. on Fox Tallahassee.